Hi everyone, this is Saili Tendorkar, clinical dietitian and nutritionist, and I am live from Shwas for You Polyclinic. And we are, as our series is going on, women's health. So we spoke about many topics regarding women's health. Uh, in early, last couple of sessions we have covered diet in pregnancy, diet in lactation, and today we are going to talk about menopause. So how to manage menopausal symptoms with your diet. Okay, so basically you need to understand what is menopause. So menopause is a natural biological process which marks an end to the woman's reproductive years, so which is between late 40s and early 50s. Women experience change in their hormonal levels. And what are the changes we see in the hormones is a decrease in estrogen production. So these are the symptoms, and these hormonal changes happens. And what are the symptoms? Hot flushes, mood swings, sleep disturbance, and there's change in metabolism, weight gain. So all these symptoms you see during menopausal period. So now what we can do through diet, how we need to uh, uh, add certain ingredients in diet which will help to reduce these symptoms. So basically we spoke about balanced food also, balanced diet also. So you need to include all food groups, try to include complex carbohydrate, try to include lots of colorful vegetables, nuts in your diet. It will help for overall well-being. Again, very important is about some vitamins and minerals. So we'll talk about calcium and vitamin D. So when women go through menopausal phase, there's an increased risk of bone loss. Okay, so we need to ensure that good amount of calcium and vitamin D. So, what are the sources of calcium? Very first, milk and milk products are the good sources of calcium. Then you can include uh, leafy vegetables, nuts, and some fortified foods also contains calcium. And for vitamin D, I even spoke in a couple of lectures before that you need to go in sunlight, and between 10 to 1 o'clock, which will help for better absorption of vitamin C. So vitamin D. So vitamin D uh, is absorbed. Your sun rays helps to convert this vitamin into vitamin D. Next is about phytoestrogens. So, some plant-based food that contains some compounds which are called as phytoestrogens. So, which has estrogen-like effects. Try to incorporate these kind of ingredients in your daily diet. For example, is soy is good source of phytoestrogen, then flax seeds, then some grains and legumes, which will help to reduce these symptoms in your daily diet. It will reduce the symptoms of hot flushes as well. Okay, try to include good amount of omega-3 fatty acid. Again, these are having anti-inflammatory properties and helps in reducing your mood swings and even your joint pain. So what are the sources of omega-3 fatty acids? Your fish, salmon, mackerel, these kind of fish, and even walnuts and flax seeds. These are good sources of omega-3. Try to incorporate in your daily diet. So flaxseed in the form of chutney, or you can add it in your chapati, puri, atta, or you can add in your salad. Walnuts, you can soak it overnight and have it in the morning. That will be more helpful. Okay, then we'll talk about caffeine. So try to reduce caffeine intake, try to reduce alcohol intake, because it will aggravate your symptoms, which and even disturb your sleep. So hot flushes kind of symptoms will increase. Then we'll talk about hydration. So hydration is very important in menopausal period. In overall, it is important, but when your hormones are already disturbed, the changes or the you will see more change in your skin. So if your hydration is not proper or it is inappropriate, then you will see that there is a you have dry skin or even vaginal dryness. You will notice if the hydration is not proper or enough. Try to limit your processed food, try to limit sugar intake. So sugar syrups, sharbat, or even bakery products, try to limit these products, because again it is going to exaggerate your mood swings, and even for overall health it is not good for you, as we have seen lot many women gain weight uh, post menopause. Okay, try to control on your portion size. We spoke about portion size also. Try to take small thali and katori and eat only when you are hungry. That is very important. And try to follow your daily routine according to your hunger. All right, again, try to add a physical activity in your daily routine. So minimum 1 hour of physical activity is required to reduce the symptoms, as well as to to promote overall well-being. Okay, so try to incorporate yoga, try to incorporate breathing exercise, which is more important for overall your mood swing. It is more helpful. So try to incorporate yoga as well as some aerobic exercise in your daily routine. So these are some kind of tips for women who are into premenopausal phase, or they are, if they are into menopausal phase, try to incorporate this 8-10 tips in your daily routine, which will be more helpful. So thank you so much, and we will come back with some other topic regarding women's health, and we will get back to you soon on next Wednesday. Thank you so much. Bye.